are being offered new treatments to fight the virus. The antibody and antiviral drugs significantly reduce the likelihood of serious illness. Our medical editor, Fergus Walsh, has been to the Royal Victoria Infirmary in Newcastle, where the first COVID-19 patient was cared for just over 2 years ago, and he's been finding out how medical treatments have improved.
COVID-fighting antibodies in a bottle. 100,000 doses of sotrovimab are on order for vulnerable patients like David, who is immunosuppressed and COVID positive.
Hiya, David. Let's get you hooked up.
The monoclonal antibody cuts the risk of hospital admission and death by up to 80%. As soon as this one-off infusion is over, David will continue self-isolating at home.
I was only diagnosed with COVID yesterday, and I'm receiving this already. It'll boost my ability to fight the virus. I'll give it a helping hand.
Matthias Schmidt treated the UK's very first COVID patient in January 2020.
We didn't know what we were dealing with. It was an unknown disease.
He says doctors are now far better equipped to combat the virus.
2 years ago, we had nothing. Now we have a range of treatments available which reduce the severity and prevent death in a huge number of patients.
The aim now is to stop COVID before it takes hold, with antiviral pills like molnupiravir and Paxlovid to be taken at home. The hospital pharmacy is dispatching prescriptions to higher-risk adults newly diagnosed with COVID. In trials, Paxlovid cut the risk of hospital admission by nearly 90%.
As you can see today, we've got 2 empty beds, so we can immediately admit 2 critically ill patients who require intensive care.
The reduction in pressure on the NHS is largely due to vaccines, which are keeping the vulnerable out of hospital. The milder Omicron variant is also helping.
It's a very different situation to where we were during the peak of the pandemic, with the unit entirely full of COVID.
At the peak, a year ago, there were 90 COVID patients in critical care across the trust. Now, there are 3. And when COVID patients are admitted to hospital, it's usually to general wards like this one.
You're looking much better.
You're definitely looking better, James.
Thank you.
COVID patients like James are treated and discharged home in days rather than weeks.
I'm just going to do a test to see how fast and how much you can blow out.
But this virus is leaving a bitter legacy. Long COVID.
You really do blast the air out.
Danielle got infected in the first wave. A fitness instructor, she still suffers severe fatigue and brain fog nearly 2 years later.
I'm 31, but I feel like I'm 61. I feel like my body just is so much older than what I am. I have